Hey there, welcome to our third episode of WOCA Style. Today's episode is going to be fantastic. I feel like this is probably one of the leading things that affect women of a certain age, and it's menopause. Um, Before we jump into that topic, though, I want to say hello to my co host, Sonia,
Hello.
and other co host, Sharita.
Morning.
And I want to say a very special welcome to our professional subject matter expert, Dr. Tracy Banks. So, everybody, welcome
Hello.
Dr. Tracy.
Thank you. Thank you. Good morning. Thank you so much for giving me this opportunity and having me on today. I appreciate it.
Yes, it is a pleasure. And we are excited to have somebody set us straight and, answer some of those questions that we think that we know the answers to, or, we're just unclear. So, we're very happy to have you here. Um, I think what we need though to start off is, can you give us a definition of menopause? Like, what exactly is menopause?
Sure. So basically, the word menopause just means your last menstrual period. But more from a global perspective, that just doesn't happen, and it's not in a vacuum. Like, it doesn't just happen one day. There's a transition period. Just like all of us started our period differently, we all end our periods differently. And it's
Mhm.
basically our bodies going from a reproductive stage of life to a non-reproductive stage of life. And it doesn't happen just like that. For some people it does, and they are the lucky ones. But for a lot of us, it is a transition that can take years. And it's that transition part, it's that perimenopause part, which is the period around menopause that gives us so much grief as our body goes through that transition.
And so, what's the average age that people start this perimenopause?
Well, the average age of menopause, believe it or not, it's pushing up. So it used to be 50 when I started 30 years ago. Then it went to 51. Now the average age is 52. I'm 56, and I just, as of November, can consider myself menopausal. And we consider people menopausal or postmenopausal when they've gone 1 year without a period. One
Hmm.
year. So during that transition period, your period, I like to say like this. So menopause is basically your ovaries retiring, right? Your ovaries have two jobs. One is to release an egg every month. The other is to make estrogen. So the ovaries are like Michael Jordan. They get lazy. They're like, they look at retirement, they flirt with retirement, but it takes a while before they fully retire. So while they're flirting with retirement, that's that perimenopausal period. And they're like, you know what? We don't feel like making an egg this month. So when the ovaries doesn't make an egg, the lining of your uterus keeps building up and building up. Where is that egg? I'm waiting for that egg. And that's when you start skipping periods and your period becomes irregular. And then finally they'll say, okay, we'll make an egg. It may be 2 or 3 months later, and then you'll have a period that's crazy. Or sometimes that lining builds up so much, it can cause irregular bleeding. And that's another hallmark of perimenopause. So it's all your ovaries' fault.
So, I don't know if I'm
Sounds
clear
good.
about like the difference between perimenopause and menopause. So, is
So
that
when
a
I usually
time?
give a talk about this, I give a graph. So you're born, you go through puberty, right? And then you
Mhm.
become reproductive. Every month, your ovaries are making an egg, your hormones are doing this, and your body's making estrogen. Then, as you get into, usually perimenopause starts after 45. So between 45 into your 50s, your ovaries get a little lazy. They stop making eggs. So perimenopause is that time where your body's getting ready to become non-reproductive. Is when the ovaries are looking at retirement, but they're not quite there. I like the Michael Jordan analogy. He went in retirement, came out of retirement, back and forth. That's what your ovaries do. They're like, okay, we're gonna work now. Then all of a sudden, like, you know what? We're gonna take a little break. And so then you might start getting hot flashes, you'll start skipping periods. Then all of a sudden the hot flashes go away, and guess what? A period comes, which is why we tell you you're not menopausal till you go a full year. personally, I went 4 months without a period, then 7 months without a period. I went 9 months without a period. I thought, okay, my hormones are saying I'm there. I am not going to have any more periods. And God dog it, the hot flashes went away, and bam, I had another period. I had to start the clock over again. That's why I say I just made it my year in November, and I've been going through this perimenopause thing for a couple of years. So,
Okay, I
does that
got
make
it.
sense? That cleared up a little bit for you?
Yes.
So can I say
So
that?
perimenopausal is just that time where you're not menopausal, your ovaries haven't completely retired, but they're flirting with retirement. Does that make it a little bit better?
Yes. Yeah.
Okay.
And just to talk about like what that experience is, so that you know that people are clear that it's just not about this time frame leading up to that 1 year period when you're free of your period. For me personally, I started perimenopause much earlier than 45, and it lasted a whole good 10 years. And I'm somebody that never ever experienced PMS, so I was lucky in that respect. But I knew so many of my friends that did experience PMS. That's one person I knew who put her period on the refrigerator so that her husband would be on alert for when he started acting like a raving lunatic. And then even their daughter, they say you sync up females in a household, and so the both of them had to know when this was happening. So for me, perimenopause was like like what I would believe PMS would be like on crack. It or steroids. It was just I felt like I was out of my mind for 10 years. Can you explain what happens to the female body when you are, I guess, in and out of estrogen, deficient in something that really causes this prolonged period, 10 years?
So I want to clear the air a little bit. PMS and perimenopause, two different things.
Yes.
What you may so if I were to ask you some personal questions, I don't know how deep down you want to get, but what did you consider perimenopause? What symptoms were you having? Because let me ask you one simple question. During that time you're saying you were perimenopausal, did you have regular periods?
So at that time and I'm one who could set my period by, like, I even know what time it's coming. But so they did start to become unpredictable each month.
Did you have monthly periods?
I would have months where I would skip. Start early on, like for the first few years, I would have months where I would skip, and then I would go months.
Okay, so not quite sure that was quite perimenopause. There's a lot of overlap between several different things in gynecology. So PMS, there is PMS, and there's something called PMDD. So PMDD is PMS on crack, like you would say, where your hormones are flaring right before your period. Nothing to do with menopause. You could be 25 and have PMDD. So not due to menopause. What that is more specifically is every month your hormones are doing this, right? That's the way Mother Nature made it for us. But what PMS is, what PMDD is, our body's having an abnormal reaction to those fluctuations in hormones. And that can be depression, more commonly irritability. I call it short fuse syndrome. You put that on the wrong side of the sink, and I'm mad at you because of that. We're mad about little things. That's more PMS, PMDD, which is kind of different. So what people have done, they've kind of lumped everything into menopause. And so to kind of set the record straight, here's what happens when you're perimenopausal. So your periods can become irregular. If you're having monthly periods, I will argue you're not perimenopausal You may be, but you're not. But that's a good barometer that your hormones are doing what they should do. Your brain hormones are telling your ovarian hormones what to do, and your ovaries telling your uterus what to do. That's a good barometer that your hormones are not decreasing. But with perimenopause, as your hormones start to decrease and your ovaries don't make that egg, you skip months. But then it may flip on you where you skip so many months that lining just builds up so much it can no longer hold itself, and then you may start bleeding like crazy. You may bleed for 3 weeks. You may bleed for 2 months. You may bleed every week. You have that's because the lining keeps waiting for that egg to come, and it's like, okay, I can't hold it anymore, and just starts bleeding a little bit here, a little bit there. It doesn't get that clear signal to have a nice shed. So irregular bleeding is a hallmark of perimenopause. And then you have hot flashes.
I went for years where I really thought that I had to take out stock in feminine products.
Mm-hmm.
And I could never leave my house without wearing a liner because I never knew when I would go to the bathroom and there would be blood. And it was crazy. And then and listen, I'm the same person who had an IUD in for 10 years and bled they say it stops, and I bled the whole time. But so yeah, the bleeding was horrible.
Yes. So abnormal bleeding, hallmark, hot flashes. As your ovaries stop making those, I like to call them power surges, actually. I'll tell myself, having a power surge.
I like that. That's really nice.
I'm really use that. But so when you're around your male colleagues, say, I'm having a power surge. Thank you very much. But anyway, so what, as your estrogen levels go down, somehow estrogen affects our thermal regulation. So we get this feeling of heat that just rises. We start sweating. We feel like we want to take everything off. That is the hallmark of menopause. And believe it or not everybody has that. There are people who don't get hot flashes. There are people just one day have their last period and they have no other symptoms. But
that's Cassandra.
I have not had hot flashes. As a matter of fact,
I
went to my doctor
I
said, am I having menopause? I need to know what's going on. Why don't I have hot flashes? And she was like, you need to be grateful you don't have hot flashes.
Yes. You are lucky. I envy you.
Ooh, Lord.
That's what you don't want.
So,
yes.
What?
Dr. Tracy, so I have a question.
Sure.
So you told us about the year, you wait a year until you don't have a period, and then but what happens if you have a hysterectomy or a partial hysterectomy and it stops? How do you gauge that? Because of course,
Great question. So if my patients have had a hysterectomy, we don't have your period to guide us anymore, which is how we make it, but we can check hormone levels. So this is the one time where we can check something called a FSH, which is a follicle stimulating hormone, which goes high when you're menopausal. So what I usually do in people who had a hysterectomy, if they start telling me they've had hot flashes, night sweats, and those symptoms, I'll say, okay, let's check your hormone levels and see if you're in the menopausal range. If they don't have any of those symptoms and they're like 52, I'll say, let's check your hormone levels to see if you're there. You may be one of those lucky ones that are not having any symptoms. So we can check an FSH to see if you're menopausal or not.
FSH.
F is in Frank, SH, follicle stimulating hormone. And it goes high when you're menopausal. So it's a hormone made by your pituitary gland that's trying to tell your ovaries you need to make an egg. And it's feedback with estrogen. So when your estrogen levels are low, it's saying, okay, ovaries, you're not working. It's like giving your ovaries gas. You need to work. And so it goes really high, trying to make those ovaries make an egg. But the ovaries are like, we're in Jamaica. We're retired. We're not doing it anymore.
I like that. Okay, perfect. Yeah, because I was wondering how you would know. So that's perfect.
Yes. But I also want to talk about night sweat. So some women get hot flashes, which are those power surges during the days. But to me, the worst thing were the night sweats. And I think night sweats are the worst because they affect sleep. Night sweats are similar to hot flashes, but it happens at night, and you really feel like it's raining in the room. Your nightgown is soaked. You don't want anybody touching you. You put your leg out to get cool, and then a few minutes later, you're cold.
Bringing
and
it back in.
and you put the
Yes.
cover back on, and then it's hot again. And so the problem with night sweats are we don't get a chance to go down to REM sleep. So we're not getting good sleep. It's affecting our sleep. So then that indirectly leads to the other symptom that people attribute to menopause, which is mood swings. So, we spend the whole night not sleeping. Of course, we're going to be grumpy in the morning and irritable and moody and tired. So all of those symptoms that go with menopause are really indirect, usually of having bad night sweats.
Makes sense.
So all
Well,
of these,
I have been Googling symptoms of menopause, right? And I found this one article there's 66 symptoms of menopause. I was like, I had no idea because, the common symptoms that I'm aware of, hot flashes, vaginal dryness, that kind of stuff. I can tell you from my experience, I don't have hot flashes. I do have vaginal dryness. My skin has a different texture. I don't know if that's related, but according to this list of 66 symptoms, that was one of them, which I didn't attribute to menopause. Can you tell us some of the things, like for me, I think I have like a list, vaginal dryness. Everybody can attest that that's an issue, right?
Right, absolutely. So they're what we call
what causes that to happen, and then how can we turn that around?
Okay. So there are early symptoms of menopause or perimenopause as we're going through it. That's your hot flashes, your night sweats, your mood swings, your sleep disturbances. Those are the early symptoms. But what we all grow out of those, right? If we were to do nothing, so say you had hot flashes and you did nothing, eventually with time, those do get better. Now, they may not completely go away. You may have one every once in a while or once a day, but most people tend to grow out of that. Then there are the late symptoms of menopause, which are due to prolonged lack of estrogen, and vaginal dryness is one of them. So the vagina loves estrogen. Estrogen makes it younger looking. It makes it has elasticity. It helps with the without estrogen, the lining becomes thin, very thin. It tends to constrict, and it loses that elasticity factor that can make pain with sex in this period of life. And then that can lead to decreased libido, who wants to have sex if it hurts? So as at the turn of the century, 1900, we were not living to menopause, right? We were dying in our 40s and 50s. It's only been in this last century that now, as medical advances are happening, we're spending a third of our life postmenopausal. And it's been a while, it's taken a while for medicine and everybody to catch up with that these changes that are happening to us. So as the lining is thin, as it loses elasticity, that causes vaginal dryness, and you have decreased lubrication. The technical word for that is atrophic vaginitis. It's just a thinning of the tissue or the lining of the vagina due to a lack of estrogen. The good news is we can fix that. We can give you estrogen. But first of all, when you get to be a woman of a certain age, you have to realize lubricant needs to be, and it just needs to be a thing. It just needs to be something that you just have, that you use. Because a lot of people will come to me complaining, and the first thing I ask, well, do you use a lubricant? No, but now's the time. We have to embrace that maybe we need to start using a lubricant.
Sometimes you don't have time to get to it.
Well, but if I nightstand, the one I recommend actually is called Astroglide, because it has more staying power. Astroglide. I don't own any stock in it, but anyway. So anyway,
let me write that down. Astroglide.
Write that down. Well, listen, I have this as my notes.
Put that in the comments, Cassandra. You need to put it
right. Astroglide.
Okay.
But we can help with the vaginal dryness by giving you estrogen down there. And so we'll talk about hormones because there's a lot of controversy around hormones. I definitely want to make sure we talk about that. But vaginal estrogen pretty much stays down there, and you can apply it via a cream, a tablet, or a ring that you put in for 3 months, and it just gives estrogen down there. And you change it out every 3 months. So it's not something. So the creams and the tablets, I usually tell people use it every night for 2 weeks. Then going forward, use it 2 to 3 times a week, and that should help with the dryness, with the pain with sex, and usually after 2 weeks you see an improvement.
Oh.
There's another treatment.
You said a ring.
Question. Yes, there's a little plastic ring that you get. It's called a S-string, and you insert it vaginally, stays in for 90 days, and it just gradually gives you estrogen to that tissue. Now you can take it out when you have sex, or and then put it back in, or I've had people leave it in and tell me that was a good thing. But anyway, it's
Well, that's what I was getting at, because I know that there is a sexual sex toy, if you will, ring. Right?
I think that's very different.
Okay.
I think it's a little different too. I think that's a different thing.
It's very nice,
The
but
different
it's not that
show.
different.
Oh, okay. I'm sorry.
That's another show.
Oh.
That's another show.
Yes, that's another show.
That's what I was like. You said
Definitely.
what?
About that one.
There's also a pill that you can take every day called Ospina, Osphena, which also is for atrophic vaginitis, which will help with vaginal dryness and discomfort down there. But then there's people who can't take estrogen, right? There's people who have a history of breast cancer or blood clots who might not be able to take estrogen. Then we go to the laser treatments. There's a laser treatment called the Mona Lisa Touch. It is 3 treatments, 6 weeks apart, that kind of helps rejuvenate down there. It brings in collagen and blood there that kind of helps with elasticity and do things that estrogen do. So for people who estrogen doesn't work very well, or people who have breast cancer or who can't take estrogen, that's another alternative. The problem with the Mona Lisa Touch, though, it's not paid by insurance. It's a cash only type situation, but it works. If
it was
besides-
I bet it would be paid for. That's another thing that irritates me. When men can't function, they can get Viagra to function. For a female, nothing is covered. It's like, oh well, that's your lot in life.
Yep.
You are absolutely right.
Yeah.
So so back to the Mona Lisa Touch.
Okay.
Besides the vaginal dryness, what other benefits do you get from getting this procedure or this?
Sure. So there's women who have something called lichen sclerosis. So as you get older, the vulva and the vaginal can, for lack of a word, just has a different tissue. It becomes very white, very thin, can be very itchy and burning. Something called lichen sclerosis. It helps for that as well. So it can help for, we call those dermatoses that happen down the vulva. Because what it does, it causes a little trauma to the area, right? With the laser, like say that we do our face to get the collagen in our face. We do the laser therapy, the needling. It's just similar to that down there, and it helps bring in blood supply and collagen. I call it to make the vagina more younger looking.
Like rejuvenation,
help
right?
with scar tissue that's down there as well, too.
Is that vaginal rejuvenation?
Yeah. Is it similar to that?
Is it similar to what?
Vaginal rejuvenation.
It is, yeah, I guess you could lump it in that category.
Okay.
And
well, I have a quick question. So if you use the ring and it I guess inadvertently releases the estrogen 90 days, does that estrogen also help with the estrogen that you're lacking in your body? Would you see other?
Probably not. Very little of it. Not with that ring. There is a vaginal ring that does do that. It's called a fem ring. But
Oh, okay.
this ring, there are a lot of different rings.
Ah,
But this ring, and the things I mentioned earlier are specifically for, it's pretty much stays local to help the vagina become more younger looking.
okay. Okay.
But let's take this discussion to treatment options for hot flashes, those kind of things. Is that okay?
Yes. Yes,
Okay.
please.
Absolutely.
So 20 years ago, because we mentioned face and all that. So 20 years ago, when someone would come to me and say, hey, I'm going through the change, we would write them a prescription for hormones and say, take this. This is the fountain of youth. It's going to help your skin. It's going to help your heart. Take it forever. And that was pretty much the game plan for like 20 years. But then in like 2000, 2001, they finally did a study called the Women's Health Initiative study that really looked at the long-term risks and benefits of hormones. And they actually stopped the study early because they saw after 7 years, there was an increased risk of stroke, heart attack, blood clots, and breast cancer with hormones. So then people did a 180 and said, oh, hormones bad. But now we're kind of at the middle of the road. So let's just talk about someone comes to me with I have two women who are in menopause, or one lady is not having any symptoms at all, even though her hormone levels show everything is low and all that. I'm not going to give her any hormones or anything. I'm going to say, you're lucky, like Kaz, you're lucky, go on your merry way. Then I have this other lady that's hot flashing like crazy, night sweats. We're going to talk about treatment options. So treatment options, there's a spectrum. On the low end of the spectrum, we have supplements. Like that's the stuff you see on the internet, on TikTok, in your grocery store, black cohosh, Siberian rhubarb. I don't like soy. Some people put soy in that category, but I'm not a fan of soy. But black cohosh and Siberian rhubarb are clinically proven to help with mild to moderate hot flashes. So someone that's just having some mild symptoms or they're perimenopausal, I'll say, hey, let's put you on some supplements. Let's see if we can get those symptoms under control. Then moving down the spectrum in the middle of the road, we have antidepressants. There are certain types of antidepressants that help with hot flashes. There's one called Brisdale, which is really just Paxil that you can take every day. There's Effexor. There's some antihypertensive medicines. There's some non-hormonal medicines that for people who can't take hormones or don't want to take hormones or it's contraindicated, these things might help them. They'll get moderate to severe symptoms. But the gold standard over here is hormones. If I put you on hormones, it's going to pretty much take most of those symptoms away. But our current thinking about hormones is we want to put you on the lowest dose for the shortest duration. We have to individualize it. What works right for you, Sonia, might not work right for you, Cass. You can't go by your girlfriend. Same thing with the pill. You can't judge what works right for your girlfriend, what's going to work right for you. It's
Right.
Cinderella in a glass slipper. It's finding your own particular cocktail. So with hormones, we put you on the lowest dose. We keep going up to get your symptoms, pretty much manageable. Then we hold you there for a while. And then we don't want you on them, though, longer than 5 years. We try to wean you off before the 5-year mark. Don't try to stop them cold turkey, as you're going to go right back into the frying pan with the hot flashes and all that. So the best thing is try to wean off slowly. And then within hormones, we got several different delivery systems. We can take it, you put a patch on, you can put a cream on, you can put pellets in your butt, you can take it orally, you can take a shot. They're all different delivery systems of how to take hormones as well. So it's very complicated. So I can understand why people look at this like going, wow, it can be very overwhelming.
Yeah, definitely.
So
It was interesting
Dr.
that you
Tracy,
said that the hot sweats or night sweats lead into the mood swings, which people automatically lump mood swings into the category of a symptom of menopause, when in reality, it's a symptom of your lack of sleep because of night sweats.
Yes.
So I can see now, I understand the connection with the antidepressants and all that, because I mean, if I'm not sleeping well, which I don't, and I still have, I have mood swings. I don't have night sweats. So I'm trying to understand, put all these pieces together to understand why this is happening when I don't have night sweats. I have, I think like my brain doesn't shut off.
The brain fog too. What about
And
the
it's
brain?
just
Well,
like,
yeah. So you people can have mood swings, not because of menopause, but it could be, and we can dwell down this a little bit offline if you want to. We need to talk about what your sleep hygiene is. What do you do to decompress? How do you handle stress? I mean, your brain is like a computer. If I just unplug it without shutting it down, when I turn it back on again, it's kind of, what do you say, used to be kind of crazy. Your brain at night needs to shut down. We need to, I tell people good sleep hygiene, no screen the hour before you go to bed. Cut off that social media, cut
guilty.
off that TV, because that's just your brain is getting all that
Your
input,
head.
right? And then
Mm-hmm.
people like,
Mhm.
well, what should I do before I go to bed? Well, write down your things to do list for the next day. That tells your brain, hey, I wrote it down. It's protective. I don't have to keep going. Oh my gosh, I gotta remember to do this in the morning. I gotta remember to do that. Gotta get ready for that podcast tomorrow. You just write it down, get it out of your brain, prepare for the next morning, pick out what you're gonna wear, fix your food, get your coffee ready, take a nice bath or shower, read a book, do things to kind of get your brain to start to shut down. There are lots of apps. There's a Calm app that has like a sleepy story that I never can make it through. I'm always asleep before they finish the story. So you want to do things to help you get a better night's sleep. Make sure there's no ambient light in the room. Does your husband snore? Is he waking you up in the middle of the night? So those, it's complex. We like to jump everything into menopause, but there are lots of different factors here and there. Menopause is easy to blame it on, but to go down to the root cause, it may be something a little bit deeper. Does that make sense?
But
Yeah.
can we talk about what other root causes? Because I have to tell you, you're blowing my mind right now. And you might be blowing the mind of other people as well, because so many of these things um, I have learned are a direct there's a direct correlation between the loss of estrogen and progesterone and testosterone and all of these hormones that play roles in our bodies that we haven't even imagined. So I am someone that is, I was just like, I don't even care. I'm willing to risk the cancer. My mother actually took uh, hormone replacement for over 20 years, and
Mm-hmm.
she absolutely, her doctor had to tell her to stop taking them because of the risk.
Mm-hmm.
But it was, she loved them.
Mm-hmm.
And then, I come along, and I'm entering that space, and she's like, well, you can't take that because it could cause cancer. So I suffered for so long. I was on antidepressants. But I was on antidepressants, not to regulate anything other than the fact that I really thought I was losing my mind. I
Mm-hmm.
hated everybody. I wanted to kill people that I loved, including myself. It was just
Mm-hmm.
a horrible, horrible time.
Uh,
And it wasn't all connected to sleep. So I want to say, I want to give people, it makes sense what you're saying, because I am somebody that will go to sleep at 9 and wake up at 12 and stay up for 4 hours. I actually track my sleep on a sleep app. I'm hardly ever in REM. So they're definitely what you're saying, I connect with. So yes, I'm moody. My brain is foggy. I'm forgetful. I'm having hell at work because I feel like I can't keep up anymore when I used to excel. But I've
Mm.
learned that all of these things are attributed to menopause. And now you're blowing my mind telling me it's attributed to my lack of sleep. I
Right.
need to,
Well, think about it. All women go through menopause if you live long enough. Are all of us women at a certain age raging bitches? irritable? No, we're not all there. If menopause was the
Yeah.
cause of that, we all would be around. I mean, so there are other factors at play here.
But
Individual factors.
well, there is a point, because I don't know any woman. I feel like I have a pretty significant girl circle. I don't know anybody that thinks that I'm an anomaly. That they're like, oh yeah, like, yeah, I hate my husband. I would like to kill him in his sleep. And these kids are driving me absolutely crazy. And this whole phenomenon, which is been covered in the media, whatever. There's this thing at a certain age. How is it that at a certain age and not function without mommy juice or a cocktail and whatever? And then so you have alcoholism that is on the rise, for women at a certain age. It's like happy hour is becoming mandatory. You have all of these other coping mechanisms. So I did try hormone replacement therapy, because I felt like it was my only option. And I did the patch. And I got to tell you, I didn't last 4 months on the patch, because
Bleeding?
I don't want a period. And it's not
Yeah,
even,
you started bleeding.
if
Yeah.
it showed up once a month, I would be fine with that. But I don't want to bleed every other day. So, it's
That's so if you read the literature, they want us to start to put, if so you come to me, you're having all these symptoms, they want us to first put you on the patch. And if you have a uterus, now if you're menopausal and you have a uterus, you have to take, and you put you on estrogen, you have to take progesterone with it. If you take estrogen by itself and you have a uterus, that will cause precancer or cancer in your uterus. But the progesterone counteracts that. The problem with the patch is bleeding. That's why I knew you were going to say bleeding before you said it. It's hard to get that good balance, because you can take the estrogen patch and the progesterone pill, or you can get the combo patch. But to me, they cause more breakthrough bleeding than the pill. So I took the pill. With the pill, there's less breakthrough bleeding, but you have to make that decision. You have to individualize it. But let me just go back to something you said that was important. Yes, needing a cocktail, the stress we're under. It's, we're coming out of a pandemic, which none of us have ever experienced before. It's not just women of a certain age who are feeling like you are. It's the 30-year-olds and the 40-year-olds. I see it every day. Everybody is feeling stressed and wanting to, kill their husband. It's not just the women of a certain age. So we can't say it's menopause. I got 30 and 40-year-olds in my office. They feel like and it's just, I think it's the media, it's coming out this pandemic, it's everything. We got politics.
Yes.
I mean, it's everything we got going on right now.
Yep.
And we are not learning how to handle the stress and decompress. We are not taking the time to, and so I have, it's not just one of a certain age, unfortunately. I mean, we feel like because that's where we are now, but trust me, you talk to 30 and 40, 20 years old. I get 20-year-olds coming in and talking about decreased libido and the same things my menopausal ladies are talking about now. It is the sign of the times, I think. And so I talk to my patients about, what do you do to decompress? You're like, well, I can't. I got my kids, I got my husband, I got my parents. We've got all these things pulling on us. I say, well, we need to move it up. We need to self-care. We need to move that up the chain. We need to put that on the front burner. And I'm a big fan of meditation. That right now they got Calm app, they got Headspace app, they got all these apps. You can take 10 to 15 minutes of your day, first thing in the morning, go on your she shed. It could be your bathroom, it could be your car, it could be your back porch. Put your headphones in and just listen to what they say. And I tell people, if you commit to it for 2 weeks, you will notice you feel a sense of calm, ease, not so overwhelmed. That's for a societal thing than I think a menopause thing. I mean, we like to blame everything on menopause. It's easy, right? It's
Yeah.
menopausal. But it doesn't explain why we all women kind of feel this way right now. And it's not just a woman of a certain age, I think. That's
Well,
my
that makes sense. Yeah. And I guess if we're not around people that are younger, you would know that. We're just feeling like we're talking to our peers and everybody's at this age and we're thinking, oh my God, it must be menopause because we're going through it.
Right.
So it makes a lot of difference. But thanks for I was going to ask you, what are some of the ideas that you can give out for stress relieving and the meditation and I even tried yoga.
Yeah,
Not so good at it, but
yoga, exercise. That if as long as exercise doesn't become like a chore, exercise because you love to do it and you like the endorphin release afterwards. You know, extra. Hey, just go for a walk around the block in nature. Just getting outside and be like, oh, look,
yeah,
the trees are blooming today. You know, just being mindful.
yeah,
You know, things. I mean, that all helps us, and we don't do it. We don't. We don't make that our
And you know
priority.
what?
Get a massage.
that's true. Yes, true.
This therapist, when I was going through the worst of it, and just, I wanted out of my life, my marriage, everything. The therapist, had convinced me that, that my husband, that I was drowning and my husband wasn't throwing me a life raft. And that impacted me for a really long time because it gave me permission to blame him for what I was going through. She was
Mhm.
actually really, really wrong. And it's the mistake I think that we as women make a lot. We're always testing people that we love because we wear the cape and we do everything unconditionally for everybody else. When we're drowning, we want people to recognize that, hey, this is I'm not doing the norm here. You should see me, flailing, and you should throw me a life raft. But when you're on a plane, they say put yours on first. Like
Yeah.
you're drowning. Stop waiting for somebody to throw you a life raft and put your own
Yes.
life vest on. And then also stop waiting for people to say, what can I do to help you? Because they're not you've been superwoman all your life. They don't think you need anything.
Yes.
And what I realize is that my husband would never say no to me. If I asked him to do something, hey, I know you can't cook, but you know how to season the chicken, or or do this, or put this in the oven, or can you go clean that room, or can you whatever. He's not going to say no. But me waiting around for him to see that it needs doing is never going to happen. It's going to make me more crazy. So and I say to people, yes, you do need to meditate. You do need to do you do need to take a walk. And that whole thing about putting yourself first, that sounds so selfish, but
But it's true.
it's your life preserver.
It's
You're not
very
going to be
true.
able to give anybody anything if you have nothing to give. And that sounds
Right.
cliche, but that
So
it really is the truth.
so as a gynecologist, I feel like I'm part counselor therapist, I'm part sex therapist, I'm part everything. And I hear everything. And I've been doing this for 30
Sure.
years. So but I tell people when they complain about husbands, children, I said, you know what? Your husband is a mountain. You can, whatever, he ain't gonna change, right? He is what he is. Let's stop trying to change him. Let's
Yep.
stop trying to, let's figure out, we need to change your mindset, your frame. How are you going to look at this mountain differently? Are you going to go through the mountain? Are you going to go around the mountain? Are you going to go over the mountain? How are you going? Nothing's going to change until you change your mindset and start looking at him with different
Yep.
glasses.
Yeah.
Yeah.
Then, and a lot of times when we do that, when we look at somebody or something different with different glasses, we start to see the change we wanted in them. It's amazing how that happens, but it has to
Yes.
start with us, not
Yes.
them. You can't try to change them and make them do something. They who they are. Only thing you can change is how you look at them and how you're going to react to them. You can decide, they're this way. I can't do it anymore. There's nothing I can do to change the way I think. Got to move on. Or you look at them and say, you know what? Let me try to find something positive. And then
Yeah.
you run with that. Let me try to look at this person a different way. He's this, on the same token, he's this. And this good stuff outweighs this. concentrate on the good. You know, you got to change your own mindset. That's for anybody in life, I think.
Yeah.
We're going to
love
get off
that.
of menopause now,
Absolutely.
but yeah.
No, and I feel like we this is just the tip of the iceberg of the conversation, and I want to continue this conversation, but it looks like we're running out of time. And so if you don't mind, doctor, I'd like to have like a part 2 so we can continue this discussion, because there's so much more. Like, you've really opened our eyes, and I have been very guilty of making menopause my problem. Like, oh, that's because of menopause, and the reality of it is it
It's
probably
not.
is not. So I'd like to further this conversation on a part 2, if you guys don't mind. But thank you so much for today. This was really, really exciting and interesting. I've learned so much, and I think that people who are watching are going to come away with insight, right? They can better approach what they're going through and understand, how to overcome it. So, and I do want to continue the conversation. So for now, we're going to end the show. Thank you for watching. And please make sure that you like, comment, subscribe, and share, because this is important stuff that we're covering, and we want to be a public service to you guys. So thank you again, and we'll see you next time.
Thank you.
Good show. Absolutely. Learn.